What are the site and timing of origin of primordial germ cells? Site of primordial germ cell (PGC). Site of primordial germ cell is epiblast. Timing of origin of primordial germ cell is second week of embryonic development. Correct sequence of stem cell potency based on ability to differentiate is T more than P more than M more than O more than U. Code is TPMOU. Totipotent more than, pluripotent more than, multipotent more than, oligopotent more than, unipotent. So TPMOU, totipotent more than, pluripotent more than, multipotent more than, oligopotent more than, unipotent. So this is the correct sequence of stem cell potency based on their ability to differentiate from highest to lowest. What is a part of embryo that exerts morphogenetic stimulus on its adjacent part called? It is organizer. Primary organizer, secondary organizer, tertiary organizer. Primary organizer, example blastopore. Secondary organizer, example notochord. Tertiary organizer, example neural tube. During which phase of meiotic division are leptothene and zygothene stages seen? Leptothene and zygothene are stages of prophase 1 of meiosis 1. First meiotic division and second meiotic division. First meiotic division means meiosis 1. Second meiotic division means meiosis 2. First meiotic division, meiosis 1, which includes prophase 1, metaphase 1, anaphase 1, telophase 1. Second meiotic division is meiosis 2. It includes prophase 2, metaphase 2, anaphase 2, telophase 2. During which phase of meiotic division are leptothene and zygothene stages seen? Leptothene and zygothene are stages of prophase 1 of meiosis 1. In prophase 1, there is leptothene, zygothene, pachythene, diplothene, diakinesis. Which of the following represents the embryonic period of development? Embryonic period extends from 3rd week of intrauterine life to 8th week of intrauterine life. So embryonic period of development is 3 to 8 weeks. Pre-embryonic period is first 2 weeks. Embryonic period is 3 to 8 weeks. Fetal period is 9 weeks to birth. Pre-embryonic period, first 2 weeks, there is differentiation of embryoblast to 2-layered, that is bilaminar germ disc. Embryonic period 3 to 8 weeks, there is differentiation of trilaminar germ disc. During which stage of prenatal development does gastrulation occur? So gastrulation occurs during embryonic period at the 3rd week of gestation. During 3rd week of intrauterine life, 3 definitive germ layers are formed: ectoderm, mesoderm, endoderm. 3 germ layers develop from epiblast by a process of cell proliferation and migration, which is known as gastrulation. So, during which stage of prenatal development does gastrulation occur? It is embryonic period. When does spermatogenesis begin? Spermatogenesis starts at puberty. Which of the following cells remain dormant in the testis until puberty? It is primordial germ cells, PGC. Primordial germ cells remain dormant in the testis until puberty. Which of the following cells have haploid number of chromosomes? Secondary spermatocytes. Secondary spermatocytes have haploid number of chromosomes. During process of spermatogenesis, each primary spermatocyte give rise to 4 sperm cells. Which stage of spermatogenesis is characterized by independent assortment of maternal and paternal chromosomes? It is primary spermatocyte to secondary spermatocyte. So independent assortment, it is the random distribution of chromosomes. It takes place during meiosis 1, where there is division from primary spermatocyte to secondary spermatocyte. The law of independent assortment states that alleles for separate traits are passed independently of one another into the gametes. Which of the following transformations is seen in spermiogenesis? Spermiogenesis or spermatogenesis is the process of maturation of spermatids to spermatozoa. Spermiogenesis or spermatogenesis, it is the final stage of spermatogenesis. Major events occurring during spermiogenesis include nuclear morphogenesis and condensation, formation of tail, formation of acrosome, rearrangement of organelles like mitochondria, centrioles, shedding of excess cytoplasm. Spermatogenesis is completed in approximately how many days? It takes 74 days. Spermatogenesis covers entire process of sperm formation from spermatogonia into spermatozoa. Spermiogenesis covers the process of transformation from spermatid into spermatozoa. Spermatogenesis, it is spermatogonia into spermatozoa. Spermiogenesis, it is from spermatid into spermatozoa. Which organelle give rise to acrosomal cap of sperm? Acrosomal cap of sperm is derived from Golgi apparatus. Head of sperm from nucleus, acrosomal cap from Golgi apparatus, spiral sheath around the middle piece from mitochondria, shed as residual bodies of regard is from cytoplasm, covering of spermatozoa is from cell membrane. Proximal centriole and distal centriole, it is from centrosome. Spermatozoa attain motility in epididymis. Spermatozoa attain full motility during their passage through epididymis. This involves activation of unique set of cation channel proteins from the Caspar family located in principal piece of sperm tail. You reassured the parents after you noted cryptorchidism in a premature baby. Which of the following cells are responsible for secreting the hormone responsible for its normal descent? Testosterone is involved in testicular descent. They are secreted by Leydig cells. The secretion of testosterone from Leydig cells is under the control of LH, that is luteinizing hormone. Which of the following cells remain dormant in the ovary until puberty? Primary oocytes. Primary oocytes remain dormant in the ovary until puberty. They are arrested in prophase of meiosis 1. Prophase of meiosis 1 include dictyotin or diplotin. A 30-year-old woman came to obstetrician for IVF. FSH analogues were injected to induce follicular growth, and HCG was injected to induce final oocyte maturation. The oocyte was then retrieved transvaginally. The oocyte thus retrieved is arrested at metaphase of meiosis 2. Secondary oocyte arrested in metaphase of meiosis 2. If the ovum is not fertilized, the corpus luteum may persist for about 2 weeks, that is 14 days. If ovum is fertilized, corpus luteum of pregnancy is formed. It persists for 3 to 4 months until the placenta takes over. Meiosis occurs in adult ovary. Meiosis takes place only in germ cells and results in the formation of haploid gamete. Which of the following is included in pre-embryonic phase of development? Pre-embryonic phase include first 2 weeks of intrauterine development. Major morphogenetic events that occur in pre-embryonic phase include fertilization, cleavage, transportation of cleaving zygote, formation of blastocyst, implantation, specialization of primordial embryonic tissue, differentiation of embryoblast to bilaminar germ disc, differentiation of trophoblast to cytotrophoblast and syncytiotrophoblast. Where does fertilization of the ovum commonly occur? Fertilization of ovum commonly occurs in the ampulla of uterine tube. What is the final step of maturation of spermatozoon before fertilization known as? The final step of maturation of spermatozoon before fertilization is known as capacitation. Capacitation involves period of conditioning of the sperm in the female reproductive tract. It lasts for about 7 hours. During fertilization, all of the following barriers in the ovum are penetrated by the sperm, which includes corona radiata, zona pellucida, oocyte cell membrane. So the 3 barriers for sperm penetration in the ovum include corona radiata, zona pellucida, oocyte cell membrane. Which of the following are the acrosomal enzymes? Acrosomal enzymes include acrosin, hyaluronidase, acid phosphatase. Which of the following event is referred to as zona reaction? Alteration of zona pellucida to prevent the entry of other sperms, that is polyspermy. To prevent polyspermy, it is known as zona reaction. Alteration of zona pellucida to prevent polyspermy is known as zona reaction. This contact results in weak membrane depolarization and calcium wave. 26-year-old man presented with sudden onset of visual loss. After evaluation, he was diagnosed with mitochondrial disorder, which was known as Leber's hereditary optic neuropathy. What is the origin of affected DNA in this condition? So, origin is maternal origin. Mitochondria and mitochondrial DNA of all human adult cells are of maternal origin. What is the normal site of implantation of the blastocyst? The blastocyst normally implants in the functional layer of uterine endometrium. Functional layer, it is also known as stratum functionale. The first two layers, stratum compactum and stratum spongiosum, together known as stratum functionale or functional layer. Blastocyst normally implants in the functional layer of uterine endometrium. What does the inner cell mass form during blastocyst formation? It forms embryoblast. The inner cell mass give rise to embryoblast, which forms the embryo proper. Fluid passes into the morula from the uterine cavity and converts it to a blastocyst with a fluid filled cavity known as blastocele. Cell mass in the blastocyst include outer cell mass, inner cell mass. Outer cell mass is called trophoblast, which forms major part of placenta. Inner cell mass is called embryoblast and forms embryo proper. Correct order of events of pre-embryonic development include from earlier stage to later stage. It is cleavage, compaction, cavitation, implantation. So events of pre-embryonic phase of development in total include fertilization, cleavage, compaction, differentiation, cavitation, hatching of the blastocyst, implantation, cell mass differentiation, bilaminar disc formation. So this is the order of event of pre-embryonic phase of development: fertilization, cleavage, compaction, differentiation, cavitation, hatching of the blastocyst, implantation, cell mass differentiation, bilaminar disc formation. Bilaminar embryonic disc is made of columnar cells of epiblast layer near the amniotic cavity. The bilaminar embryonic disc is made of epiblast layer which consists of columnar cells near the amniotic cavity and hypoblast layer which includes cuboidal cells near the blastocyst cavity. So bilaminar embryonic disc is made of columnar cells of epiblast layer near amniotic cavity. Where does Husser's membrane develop from? Husser's membrane or exocoelomic membrane develops from flattened cells derived from hypoblast. What is the part of extraembryonic mesoderm lining the amniotic cavity called? Parietal or somatopleuric extraembryonic mesoderm. It lines the amniotic cavity. So the part of extraembryonic mesoderm lining amniotic cavity, it is known as parietal or somatopleuric extraembryonic mesoderm. Parietal or somatopleuric extraembryonic mesoderm lines the trophoblast and outside of amniotic cavity. Visceral or splanchno-pleuric extraembryonic mesoderm lines the outside of yolk sac. Formation of which of the following indicates beginning of gastrulation? Formation of primitive streak from the epiblast is indicator of beginning of gastrulation. Formation of primitive streak indicates the beginning of gastrulation. Ectoderm, endoderm and mesoderm, three germ layers which is formed from epiblast. So epiblast give rise to all three germ layers through process of gastrulation. Which of the following statements regarding intraembryonic mesoderm is true? So about intraembryonic mesoderm, it is also known as secondary mesoderm. It is formed from epiblast cells. Most of the body tissues are formed from mesoderm. So intraembryonic mesoderm is also known as secondary mesoderm. Intraembryonic mesoderm is formed from epiblast cells. Most of the body tissues are formed from intraembryonic mesoderm. Arrange the following structures formed during the development of definitive notochord from earlier stage to later stage. So the correct order from earlier stage to later stage during the development of definitive notochord is blastopore, notochordal process, notochordal canal, and then notochordal plate, and finally towards definitive notochord. So blastopore, notochordal process, notochordal canal, notochordal plate, definitive notochord. So steps of notochord formation includes primitive knot, secondly primitive pit which is also known as blastopore, then notochordal process, notochordal canal, notochordal plate, and finally definitive notochord. Notochord is derived from epiblast. Notochord induces neural plate formation. Notochord persists as apical ligament of the dens. Notochord persists as nucleus pulposus. Notochord is derived from epiblast. Neurulation refers to process of formation of neural tube. Neurulation refers to process of formation of neural tube from the neural plate. 45-year-old woman presented with itchy elevated lesion on her face. On dermoscopy, there is atypical pigmented network. From which structure is the cell responsible for this lesion derived? So, asymmetrical pigmented lesion on the face with irregular border. This is suggestive of malignant melanoma arising from melanocytes. Melanocytes are derived from neural crust cells. Anomaly scan in a pregnant woman revealed renal agenesis in the fetus. Which of the following mesodermal layer is involved? So, kidneys are developed from intermediate mesoderm. So, here fetus is having renal agenesis. So, intermediate mesoderm is involved. Paraxial mesoderm forms somatomeres and somites. Intermediate mesoderm includes urinary and genital systems. Lateral plate mesoderm, it gives rise to pericardial, pleural, peritoneal cavities. 26-year-old man with congenital scoliosis is found to have hemivertebrae. The affected structures are derivatives of paraxial mesoderm. The vertebrae is derived from somites, which is derivative of paraxial mesoderm. Paraxial mesoderm during development get organized into segments known as somatomeres and somites. Somatomeres, they are 7 in number. They form mesoderm and muscles of head and jaw. By the end of 5th week, 42 to 44 pairs of somites are present. 4 occipital, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 8 to 10 coccygeal pairs are there. Which of the following give rise to pericardial cavity? Pericardial cavity is formed by intraembryonic coelom in the lateral plate mesoderm. Nucleus pulposus is derived from notochord. Which of the following structure becomes primitive gut? So, part of yolk sac lined by endoderm, it is mainly from the primitive gut. So, the primitive gut, it is derived from part of yolk sac lined by endoderm. A newborn presented to NICU with respiratory distress and meconium discharge from the umbilicus. The condition occurs due to patency of the duct that connects primitive gut to the yolk sac. So, the presence of meconium discharge at the umbilicus is suggestive of vitelline fistula. It occurs due to patent vitelline duct which connects primitive gut to yolk sac. Primitive gut is connected to definitive yolk sac through a narrow stalk-like communication known as vitello-intestinal duct. Vitellointestinal duct, it is also known as vitelline duct or yolk stalk or omphallomesenteric duct. A 32-year-old primigravida who is non-diabetic had a spontaneous miscarriage. The baby had a deformity. So, which of the following defect during embryonal development is likely to cause the given condition? So, here the baby is having cyanomelia. Cyanomelia, it is caused due to insufficient formation of mesoderm in the caudal most region. So, insufficient formation of mesoderm in the caudal most region of embryo, which causes cyanomelia. Which of the following blood vessels in the connecting stalk disappears during development? So, the right vein in the connecting stalk disappears during development. The blood vessels connecting the placenta to embryo pass through the connecting stalk. Initially, there are two arteries and two veins. Later, right vein disappears. Left vein is left behind. The connecting stalk then consists of two arteries and one vein. Which of the following structure develop into Wharton's jelly? It is extra-embryonic mesoderm. Extra-embryonic mesoderm of the connecting stalk develops into gelatinous substance known as Wharton's jelly. Wharton's jelly protects the blood vessels in the umbilical cord. Decidua is the modified endometrium. There is Decidua capsularis, Decidua basalis, Decidua parietalis. Which of the following contributes to the maternal and fetal components of the given image, that is placenta? So the maternal component of the placenta, it is from Decidua basalis, and fetal component of placenta is from chorion frondosum. Placenta is feto-maternal organ. Maternal component by Decidua basalis. Decidua basalis, it is also known as Decidua serotina or decidual plate. Fetal component, it is contributed by chorion frondosum. Statements regarding chorionic villi which is true include, so primary villi contain cytotrophoblast and syncytiotrophoblast. Secondary villi contain extraembryonic mesoderm. Secondary villi contain extraembryonic mesoderm. Secondary villi do not contain fetal capillaries. Fetal capillaries are present in tertiary villi. Tertiary villi contain extraembryonic mesoderm. So primary villi contain cytotrophoblast and syncytiotrophoblast. Secondary villi contain extraembryonic mesoderm. Secondary villi do not contain fetal capillaries. Fetal capillaries are present in tertiary villi. Tertiary villi contain extraembryonic mesoderm. Which of the following are components of definitive chorion? So, components of definitive chorion include extraembryonic somatic mesoderm, cytotrophoblast, syncytiotrophoblast. It contributes to fetal portion of placenta, including villi and villus legs. Definitive placenta layers include Langhans layer, Rohr's layer, Nitabut's layer. Langhans layer, Rohr's layer, and Nitabut's layer. Definitive placenta consists of chorionic plate on the fetal aspect and basal plate on the maternal aspect, with the intervillus space between them. Image of the chorionic plate, which is of fetal component. It consists of amnion, extraembryonic mesoderm, cytotrophoblast, syncytiotrophoblast. So, amnion, extraembryonic mesoderm, cytotrophoblast, syncytiotrophoblast. These are the structures in chorionic plate, which is of fetal component. Which of the following is present in intervillus space of placenta? Intervillus space is between chorionic plate and basal plate of placenta, which contains only maternal blood. Fetal blood circulates in the blood vessels in the villi. Maternal blood, intervillus space of placenta, there is the maternal blood. Fetal blood circulates in the blood vessels in the villi. In the fully formed placenta, intervillus space contain 150 ml of blood, which is replaced every 15 to 20 seconds. That is 3 to 4 times per minute. Definitive placenta. In the basal plate, in the maternal side, there is outer syncytiotrophoblast known as Nitabut's layer. Outer syncytiotrophoblast Nitabut's layer and inner syncytiotrophoblast Rohr's fibrinoid stria. Outer syncytiotrophoblast Nitabut's layer, inner syncytiotrophoblast Rohr's fibrinoid stria. Chorionic plate in the fetal side, there is cytotrophoblast, which is the Langhans layer, and syncytiotrophoblast. So, fetal side, chorionic plate, syncytiotrophoblast, and cytotrophoblast. Cytotrophoblast, that is Langhans layer. Maternal side, basal plate, outer syncytiotrophoblast Nitabut's layer, inner syncytiotrophoblast Rohr's fibrinoid stria. Fetal side, chorionic plate, cytotrophoblast Langhans layer. Which of the following are macrophages present in the mesoderm of the chorionic villus? It is Hofbauer cells. Hofbauer cells are fetal derived macrophages present in the placenta. Hofbauer cells are fetal derived macrophages present in the placenta. Fertilization will result in twins that are, so fertilization of two different ova by two different sperms. This will result in dizygotic twins. So dizygotic twins, that means different ova by two different sperms, which results in dizygotic twins, each with its own chorion and amnion. Amnion, it includes bichorial as well as biamnionic. So dizygotic twins with its own chorion and amnion, that too in amnion it is bichorial and biamniotic. So dizygotic, bichorial, biamniotic. Two zygotes, two chorions, two amnions. Dizygotic twins are more common than monozygotic twins. Dizygotic twins are known as fraternal twins, sibling twins, false twins. On USG examination of a pregnant woman at 15 weeks gestation, the following findings are noted. So, which of the following event will result in development of the condition? So, the USG examination is suggestive of monozygotic, monochorionic, monoamniotic twins. Duplication of the embryonic disc between 8 to 12 days after fertilization will result in this. So, duplication of embryonic disc between 8 to 12 days after fertilization will result in monozygotic, monochorionic, monoamniotic twins. In this case, two fetuses will share common chorion and common amniotic cavity. Morula cleavage by day 1 to 3, dichorionic, diamniotic twins. Blastocyst cleavage days 4 to 8, monochorionic, diamniotic. Implanted blastocyst cleavage days 8 to 13, monochorionic, monoamniotic. Formed embryonic disc cleavage days 13 to 15, conjoined twins. So again, placentation, morula cleavage days 1 to 3, DCDA. Blastocyst cleavage days 4 to 8, MCDA. Implanted blastocyst cleavage days 8 to 13, MCMA. Formed embryonic disc cleavage days 13 to 15, conjoined twins. The following finding was noted in the twins that were delivered a couple of hours ago. So, the image was showing conjoined twins with fusion in the sacral region, which is known as pygopagus. So, pygopagus, these twins are known as conjoined twins or Siamese twins. So, conjoined twins or Siamese twins. So, there are different types of conjoined twins. Pygopagus is united in the sacral region. Ichthyopagus is united at the pelvis. Omphalopagus or Syphiphagus united anteriorly from the xiphoid to the umbilicus, that is Omphalopagus or Syphiphagus. Cephalothoracopagus, it is fusion of both head and thorax. Parapagus is lateral fusion with two heads sharing a single thorax, abdomen and pelvis. So, single thorax, abdomen and pelvis with two heads, it is parapagus. Craniopagus is united at the head. Thoracopagus, which is the most common conjoined twins. thoracopagus. It is united at the thorax. So, types of conjoined twins: craniopagus, thoracopagus, cephalothoracopagus, parapagus, omphalopagus or syphipagus, ichthyopagus, pygopagus. A pregnant lady comes for routine antenatal checkup during the first trimester. USG examination reveals following finding. Identify the type of twins in this patient. So in this image we can see two separate amniotic cavities and lambda sign. So two separate amniotic cavities means diamniotic. Lambda sign, it is dichorionic. So DADC, diamniotic dichorionic. A 37-year-old man is diagnosed with renal failure and is advised to undergo renal transplantation. The patient has twin brother who is willing to donate his kidney. Which of the following types of twins are HLA identical? Hence, the recipient twin does not require immunosuppression. So, all monozygotic twins are of same gender, genetically identical. They have identical HLA genes. So, monozygotic dichorial diamniotic, monozygotic monochorial diamniotic, monozygotic monochorial monoamniotic. Repeating again, monozygotic DCDA, monozygotic MCDA, monozygotic MCMA. So all monozygotic twins are of same gender, genetically identical. They have identical HLA genes regardless of the stage of separation of cell mass. So recipient twin, they does not require immunosuppression who are in monozygotic twin. All monozygotic twin develop from single zygote. So they have similar genetic composition. So in this question, patient has twin brother. Patient is diagnosed with renal failure. He is advised to undergo renal transplantation. Patient has twin brother who is willing to donate his kidney. So which of the following types of twins are HLA identical? Hence the recipient twin does not require immunosuppression. So the answer is all monozygotic twins. Identify the type of twin babies shown in the image. So in the image they are showing monozygotic, monochorial, monoamniotic twins. So it depicts single zygote separated between 8 to 13 days and resulted in twins implanted at one site having same chorion and having single amniotic cavity. So this is monozygotic, monochorial, monoamniotic. Implanted cleavage days 8 to 13. Monozygotic, monochorial, monoamniotic.